Diseases of the urinary system can affect any of its organs and can have various causes, including infections, blockages, structural abnormalities, and other underlying health conditions. Urinary tract infections occur when bacteria and other pathogens invade the urinary tract, including the bladder, urethra, ureters, and kidneys. Common symptoms include frequent urination, a burning sensation during urination, cloudy or bloody urine, and pelvic pain. Urinary tract infections are also called bladder infections. Urinary tract infections are common, especially in women. More than half of women will have at least one urinary tract infection at some point in life. Urinary tract infections are serious and often painful, but most urinary tract infections are easy to treat with antibiotics. All women are at risk of cystitis because of their anatomy, specifically the short distance between the urethra to the anus and the urethral opening to the bladder. As a result, there is a less distance for bacteria to travel to reach the bladder. In addition, after menopause, a decline in circulating estrogen causes changes in the urinary tract. The changes can increase the risk of the urinary tract infections. Using diaphragm for birth control may increase the risk of urinary tract infections. Using spermicidal agents also can increase the risk. Urinary surgery or exam of your urinary tract that involves instruments can both increase the risk of developing urinary tract infection. You can help to prevent urinary tract infections by doing the following. Urinate after sexual activity. Stay well hydrated. Take showers instead of baths. Minimize douching sprays or powders in the genital area. Teach girls when potty training to wipe front to back. Kidney stones are hard mineral and salt deposits that form in the kidneys. They can cause severe pain when they pass through the urinary tract. Symptoms include sudden and severe back or abdominal pain, blood in the urine, frequent urination, and pain during urination. Urethritis is inflammation of the urethra and is lower urinary tract infection. The urethra is fibromuscular tube through which urine exits the body in both males and females, and semen in males. Urethritis, inflammation of the urethra, has a strong association with sexually transmitted infections, such as gonorrhea, chlamydia, and others. I hope you notice that itis means inflammation. Urethritis is the inflammation of the urethra. Cystitis, inflammation of the urinary bladder. Urinary incontinence is the involuntary loss of bladder control leading to the accidental leakage of urine. It can occur due to weakened pelvic floor muscles, nerve damage, hormone changes, or other underlying medical conditions. Kidney infections, also known as pyelonephritis. Kidney infections occur when bacteria or other pathogens infect the kidneys. Symptoms often include high fever, back pain, abdominal pain, frequent urination, and cloudy or bloody urine. If left untreated, kidney infections can cause serious complications. Bladder cancer refers to the abnormal growth of cells in the bladder lining. It often causes blood in the urine, frequent urination, pain during urination, and pelvic pain. Risk factors for bladder cancer include smoking, exposure to certain chemicals, chronic bladder infections, and family history of the disease. Here are stages of bladder cancer. In stage 0, the precancerous lesions on inner lining are found. In stage 1, malignant tumor have spread into connective tissue layer. In stage 2, tumor have spread into muscular wall. In stage 3, cancer has started to spread to local organs or pelvic lymph nodes. In stage 4, cancer has spread to major organs. Cytoscopy is the key diagnostic procedure for bladder cancer. It's allowed doctors to see inside the body within a thin, light, flexible tube called cytoscope. On this slide, you see cytoscope procedure done in male and female. A cytoscopy provides visual of the lower urinary tract and bladder lining. Chronic kidney disease is a long-term condition in which kidneys gradually lose their ability to function properly. It can be caused by various factors such as diabetes, high blood pressure, certain medications, and autoimmune diseases. Symptoms may include fatigue, swelling in the legs and ankles, changes in urination frequency, and persistent itching. The disease starts with mild loss of kidney function, then develops with moderate loss of kidney function. ending with severe loss of function and final kidney failure. In earlier stages, as kidney disease progresses, one may notice the following symptoms: nausea and vomiting, muscle cramps, loss of appetite, swelling via feet and ankles, dry itchy skin, shortness of breath, trouble sleeping, urinating either too much or too little. Treatment for chronic kidney disease focuses on slowing the progression of kidney damage, usually by controlling the cause. But even controlling the cause might not keep kidney damage from progressing. Chronic kidney disease can progress to end-stage kidney failure, which is fatal without artificial filtering, dialysis, or kidney transplant. Polycystic kidney disease is an inherited condition characterized by growth of numerous fluid-filled cysts in the kidneys. Over time, the cysts can enlarge, leading to kidney damage and impair kidney function. Common symptoms include abdominal pain, high blood pressure, blood in the urine, and recurrent kidney infections.